when we see this little wiggle here, that's the jowl, and that's a sign of aging. So that's something that we're looking at when we're assessing you.
The muscles actually get a little loose. The kicker, of course, is that we actually have bone loss. So the bone of the actual jawbone, the mandible, becomes a little thinner. So
or chin liposuction can be a really great way of revealing a beautiful jawline. Or
weirdly enough, you can actually burn or damage or create scar tissue of this mass. So you want to avoid that.
The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Welcome back to The Beauty Scientist. I'm Dr. Kristy Hamilton here with fellow board-certified plastic surgeon, Dr. Roy Kim. We are The Beauty Scientists, and we love talking all things plastic surgery, beauty, insider tips, everything you wish you knew. We are your plastic surgery besties, as they say on TikTok these days. And today we are talking about the jawline. So unlocking the secrets to a perfect jawline, surgical and non-surgical solutions. Dr. Kim, you're a facelift surgeon. First, tell me about the aging process. What is happening to the face that causes a patient to come in asking about their jawline in the first place?
Unfortunately, as we all know, as we age, a lot of it is just looseness and dropping. So gravity's going to pull things down. It's going to pull down on your cheek fat, and especially the skin around your jawline itself. So it starts a little higher, but it keeps on going down. Your neck skin also becomes a little more loose. The fat, which is healthy and makes you beautiful, starts to sag a little, which is why we have some mild jowling. And finally, the muscles actually get a little loose. The kicker, of course, is that we actually have bone loss. So the bone of the actual jawbone, the mandible, becomes a little thinner. So all of those things contribute to having a jawline that is not as sharp. You may even maintain your weight, but it just doesn't look as defined as in the past. So that's the aging process in a nutshell.
Right. And so when we look at the jawline, we have to consider, what really constitutes a really sharp, sleek jawline. So one, like you mentioned, it's the mandible itself. It's that bone structure, and we have different ways of kind of augmenting or manipulating that. Then you got to consider the soft tissues above as well as the soft tissues below. Extra fat underneath, I'm kind of demonstrating here, that really causes a loss of jawline definition if I give myself a double chin. Similarly, if I've got a lot of extra cheek volume or a really strong masseter at the back, that can hide a nice jawline. So we like to augment the mountain, so to speak, where appropriate, and make sure we've got appropriate valleys on either side so that we see a super sharp, sleek jawline. The other thing about the jawline is we want it to be straight. So when we see this little wiggle here, that's the jowl, and that's a sign of aging. So that's something that we're looking at when we're assessing you, not socially, just when you're in the office, right? Roy, everyone always asks me that. Are you analyzing everyone's face? Just in general. I said, no, only in the office. So let's talk about the most powerful solution. What's the most powerful solution for addressing a sagging jawline?
The most powerful solution is, of course, facelift neck lift. So we're able to reposition your fat underneath the chin, the submental fat. We can reposition the muscles, the platysma muscles. We can actually reposition the skin, so we can actually tighten it and remove a little, as well as sort of pull it back behind your ear, around the earlobe and in front of the ear. What's interesting is that as plastic surgeons, we know that the jawline itself is a combination of the neck and face. It's right at the interface or border. So depending on your situation, most patients honestly need a facelift neck lift. Some patients can get away with just a neck lift, but it really depends on your situation. And repositioning all those structures is much more of a procedure, like a surgical procedure, as opposed to non-surgical. Finally, to augment your chin and jawline, you may need a little fat placed here, or you actually may need a chin implant. So those are the things that we think about as plastic surgeons to give you sort of the gold standard, the best jawline possible. Anything else that you discuss with your patients, Kristy?
I think that is really talking about the chin and profile balancing. That's really important too. You want to make sure that the jawline looks good from all angles. And then finally, when we're talking about revealing a jawline, perhaps the patient has the most perfect mandible, but if they've got a lot of fat underneath, then sometimes something as simple as submental or chin liposuction can be a really great way of revealing a beautiful jawline, or it could be performed in conjunction with a small chin implant or some jawline filler. But
Yes.
Like you said, face and neck lift, that's the gold standard. That's going to give you sharpest, tightest, sleekest. So when patients come in, if they want a little lift under here, I say oftentimes we can get away with a little liposuction, but if they're doing this and pulling their face up into the side, that's surgery. That's a face and neck lift.
Yeah. And as plastic surgeons, we both know if you want the maximum result, yes, it's surgery, but also the technologies that tighten skin as a plastic surgeon, they work, but they don't work quite as well as I think a lot of consumers think. As you showed, if you're really moving the skin a lot more than half an inch or an inch, I don't think there's any technology that's really going to tighten skin that much.
I haven't seen it. You haven't seen it. And if it existed, I always tell patients, if these things existed and worked reliably and really well, we wouldn't do facelifts anymore. And we do them all the time. So
Right.
once we stop having facelift patients, then we'll know the technology has become that good. But to your point, I mean, there's a lot of patients that are like, hey, I want to do something about this. I want to make it sharper. I'm willing to do anything other than surgery. What do you tell that patient?
So there are, of course, fillers. There's ways to melt fat without surgery. We can actually tighten. Well, there's some technology that can tighten things up a little. Essentially, to get to the SMAS, the structure that really is the framework or lattice of the face, there are technologies which tighten the SMAS. They don't do it that well. As a dermatologist or non-plastic surgeon, or if you're deathly afraid of surgery, hey, they work. I wouldn't just expect miracles from it. If you actually get some of these things which are sort of cranked up in terms of power, sort of to get a maximum result, weirdly enough, you can actually burn or damage or create scar tissue of the SMAS. So you want to avoid that. If you are overweight, of course, lose weight. And if it is a spot area, there is a great injectable called Kybella. We just inject it. It melts the fat, and it does a very good job of it. Finally, with dermal fillers, we can actually sort of augment the chin, augment the jawline, make it a little more like a hill, make it more prominent so that you have a more defined jawline or sharp definition there. Anything else that you wanted to add in terms of the non-surgical stuff?
Yeah, I want to highlight the judicious use of fillers and Botox, like you said. So I love the Nefertiti lift. So injecting Botox, I'm just demonstrating along the lower portion of the face and upper neck. That allows that platysma muscle, which is, I'll demonstrate it. So it's that one, when you see those bands that stick out of the neck, it pulls the face down. And so if you relax it, it kind of falls back, cinches the neck, and kind of paradoxically creates more definition there. That's a great, way to dip your toe in. And I like performing it in conjunction with some jawline filler. And the patients go, well, I don't want a bigger jawline. And I'm like, great. We're just looking to form an optical illusion here. So if we paste some along the border, it's almost like creating that like a knife's edge along the bone itself, and a little bit in the chin goes a long way to create more of that V-like shape. So, and we're talking, a milliliter, maybe 2 milliliters of fillers is not a lot of volume, but well placed. It can serve to straighten the jawline, and then that looks very elongating and creates more of an elegant transition from the face to the neck.
Yes. And then, of course, with Botox, we can actually inject it in the master muscles. So in case you have a very wide face, what I would consider a squarish face, if you get Botox to the master muscles here, the muscle you feel when you clench your teeth, we can actually make your face a little more V-shaped, which can be aesthetically pleasing, as well as make this angle, the side of the mandible here, look more defined overall. And that is very non-surgical.
Very non-surgical, very popular treatment too, because you get that tension relief in the back from grinding, and then also get that slimming. And some patients have very, very powerful master muscles, and I just Botox mine, so it's not working to demonstrate this. But when I haven't Botox mine and I bite, my fingers go like flying off my face. Like you literally can see them kick out like this when I bite. And right now you can see just a little bit, but it's really, really, really marked when I haven't recently Botoxed them. And so I like that slimming effect that it gives. So just like we were talking about before with the facial analysis. So that's one of the ways that we're able to slim the soft tissues above to better highlight that jawline below. And it works really well.
Yeah. So, I mean, this has been a great discussion because we definitely think surgery is the most powerful. However, non-surgical options do exist in case you really don't want surgery. Perhaps you're younger, perhaps you don't have that much loose skin or laxity of the other tissues. And non-surgical approaches can actually give you a beautiful result.
They can indeed. So which of these would you have? To the listeners, what, comment below, let us know, like what would you be interested in? What are you excited about? What do you think you would never do? And then if you want us to expand on any of those topics, let us know and we can dedicate a podcast episode to that. So always fun talking about surgical and non-surgical options for the jawline. Very popular topic. And stay beautiful out there, Dr. Kim.
Stay beautiful, Kristy. Have a great day.
Thank you for joining us on The Beauty Scientist. Be sure to visit thebeautyscientist.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.